Good morning, everyone. So I'm Liz Lamb. Today we'll talk about the quality improvement model. We're going to be discussing the model for improvement from the IHI, and that's the Institute for Healthcare Improvement. And this is the framework or model that's going to support your work. Plus, I'm going to guide you through a 7-step process to doing the improvement work and give you some tools that are going to help you build your skills at the front line and really get you started. Why should we use a quality improvement framework? Well, there's lots of reasons, and it's used to develop, test, and implement those changes that can lead to the improvements. And it does help us reduce that risk by starting small. We can use it to build on best evidence and research, so we can really pull these pieces into the QI framework. And importantly, it does temper that desire to jump to solutions, which we all want to do in healthcare. So we're moving on to the model now. This is the model from the improvement from the IHI, and it's really the framework to support your work. And I like to think of it in two ways. There's the thinking part, which are the 3 questions. What are we trying to accomplish? How do we know that a change is an improvement? And what changes can we make? And then there's the doing part, which is the plan, do, study, act cycle, the PDSA cycle, as I'll call it from now on. So as well as that, I'm going to give you these 7 steps to quality improvement that I think will really help guide you to plan and execute your improvement work. And the 2 pieces are linked. I will be referring back to the model to illustrate how it supports this thinking. So the first one, define the aim. The second one, we develop a measurement plan. We map out the current state. We identify possible changes to make. And then we test out those change ideas. Once we have those ideas, we can implement those changes. And then importantly, we celebrate success and we carry on. It's continuous. So I'll go through these in more detail. Step 1, define the aim. This is really, what do you want to improve and why do you want to improve it? So let's imagine for a minute you get in an elevator, and we're looking at constructing an aim statement that will get you up to 4 floors by explaining exactly to whoever gets in the elevator next what you're trying to achieve. And it has to include these things. How good do you want to be and by when? What are the boundaries? So what's the scope or the patient population or the process that needs to be addressed? Is it consistent with organizational goals? And does it reflect the problem and the predicted results? So it's very important to keep refining this. If you go past 4 floors and you miss your exit, then it's too long. So we'll go to the model now. So step 1 really relates to the model's first question. What are you trying to accomplish? And I like to think of this acronym, this SMART aims. So they are specific. Is your aim specific? Is it measurable? Does it have some kind of measure attached to it? And then, is it achievable and realistic within your group or your skill set? And this is really something you have to discuss as a team. And we need to be time-bound. So make sure that we can have an end date, something to aim for. And in my experience, if you find it difficult to move past this stage, then refine your aim again. Go back and revisit this. It's not written in stone, but keep on refining it and revisiting it. So let's look at an example. So one example for an aim statement would be offer all patients same-day access to their primary care physician within 9 months. So let's just pull this one apart a little bit. So can we see how good we want to be and by when? Do we have a measure? So here I'm seeing 2 measures really. We can see same-day access. Is it the same day? And we can also see it's all patients. So these could be 2 measures, all patients or some of your patients. Can we see the patient population? Well, clearly we have the word patients in there and we've said all of them. And does it reflect the problem? So here I'm seeing that you don't currently have same-day access, and that's what we're trying to improve. It's in line with your organizational goals, and the scope is really clearly defined. So this is an example of a really smart aim statement. Step 2, make sure you can measure your improvement. Now, we've all experienced this. All improvement requires change, but not all change is an improvement. How many times have we experienced a change and we didn't see any improvement in there. But what's worse is think about all the times we've made an improvement and we couldn't actually prove that it was better for the patient. And I can think of lots of examples in my nursing career where this happened, and I kind of wish I'd gone back and looked at what kind of measures I would have used, because it really would have helped. So the next question in the model, how do we know that a change is an improvement? This is about your measures. Measurement is critical. What measures are we going to use? There's two kinds of measures that we typically use, and it's quantitative, and that's graphs and charts. And then there's qualitative, which is really powerful. It's about engaging hearts and minds, and it can really help to build that case for the improvement. And then how are you going to report progress to the interested parties? You really need to know who your audience is to decide which type of measures you're going to use. So let's go on to defining three kinds of measures that you might typically use. We have outcome, process, and balancing measures. Outcome measures, we're asking, did we reach the desired outcome that we intended to have? Process measures, did we say what we would do to get there? And balancing measures, were there any unintended negative consequences as a result of this? So let's go to an example. So if we go back to our aim statement, we asked if we could offer all patients same-day access to their primary care physician within 9 months. So an outcome measure could be the percentage of patients who request access to their primary care physician, that they're offered a same-day appointment. Or it could be the number of patients. But what we really want to find out here is, are we tracking this over time? Are we improving over time? So this might look like a run chart, and we can talk about things like that in a different webinar. Another one would be process measures. So let's just assume we reserve 2 appointments a day for patients requesting that same-day appointment. We really need to know, were we able to do that? So that could be a simple yes or no. And then balancing measures. Let's assume our patients were calling a week ahead, but now they were unable to get an appointment as a result of saving those 2 a day. So that would help us keep an eye on what the improvement is, how it's affecting the other parts of the system. And it's always good to have a few of these in every improvement that you're making. So I promised some tools. Here's an example from Health Quality Ontario. Their website's got some great tools to use, and you can just download them, they're PDF documents. But this is the kind of thing that will help you just guide the process of thinking about what we need to do when we talk about measures. So what kind of measures? Are they process, outcome, or balancing measures? How is it going to be collected? When is it going to be collected? Where? And who is going to be responsible for collecting that? So some of it might be electronic and you retrieve that data from a computer. Other ways, it might be something that you have to devise, like a chart, a tally chart or something like that. Now, I really want to make it easy for you as well. So think about keeping it really simple when it comes to collecting that data. So you're wondering why there's a jar of marbles on the screen. One clinic that we worked in, we wanted to find out how many orthopedic patients were actually being referred to radiology. And so the only way we could think of was going through every chart and looking through to see if a request had been made, and it was going to be very time-consuming. It was 100 and something patients a day. And then someone came up with a bright idea of, as a patient goes to radiology, let's put a ball in the jar. And by the end of the day, we count up the number of balls in the jar. So this was a really quick, easy way of collecting that information. I'd encourage you to be creative on your data collection. Try and think of easy ways of doing it. Chances are someone's doing it off the side of their desk. So step 3, we really need to map out the current state. And what I mean by that is we want to find out what's actually happening in our situation, not what we think is happening. So let's look at an example here of a clinic. Let's say the patient calls to make an appointment, and then they arrive at reception and they wait. And then they see the doctor for an assessment, and then maybe they get some treatment before they manage to go home. By mapping this out, especially with a patient and having the patient and staff perspectives on this, we can start to understand what's really happening. So Maybe the patient didn't receive an appointment, there was none available. Maybe they waited too long. Maybe they actually saw a different physician from their normal physician and this wasn't acceptable for them. So what we're trying to do is to understand what is happening here. And once we can understand what's happening, we can dig a little deeper and try and find the root cause by asking why is it happening. And once we can get to the root cause, we can demonstrate that there's a problem and we can start to tackle it. So this is all about identifying those areas for improvement. We often call this patient journey mapping, if anyone's heard of that. But it just really helps us understand where we currently sit with our work. The fourth step, now we're going to identify possible changes. So we're asking really, what can we do to improve our current situation? Again, if we refer back to the model, this is question 3 of the thinking part. What changes can we make that will result in improvement? And it's important to talk to the people who do the job. Let's share our information and experience with other healthcare services, other organizations, and the patients, because it's likely they've experienced different levels of care as they've gone through their journey. And again, we can look at resources, we can look at best practice and research and pull those into our improvement work. So we want to produce different results to historical norms, and one tool we can use is called a driver diagram. And there's a great YouTube video on the IHI website that takes you through this in about 2 minutes, but I'm going to attempt to go through it too. And a driver diagram really helps us organize change concepts and ideas within a system or within our working system. So let's look at the aim or the outcome. This is really the problem that needs to be solved. And the key drivers, so let's say, for example, it's summer. I want to lose weight. So that's my aim. That's what I want to have as an outcome. So I want to ask too, are there some measures with that? How good do I want to be and by when? So I want to lose 10 pounds in 6 months. Okay, so I've set my goals. Now, key drivers are what conditions need to exist in order to solve that problem. And there's 2 that I can think of. Unfortunately, I have to increase the amount of exercise I do, and I have to reduce my calorie intake. And again, I want to think about those measures. So how good do I want to be by when? I want to increase my exercise by 50%, and I want to reduce my calorie intake to less than 1,800 calories a day. I think that should help me lose those 10 pounds in the 6 months. And then for my actions, my objectives, these are, or I'm asking, what do I need to do to create these conditions? So I've come up with a few that I really should do that are going to help me increase my exercise. Join a gym and go, cycle to work more, maybe find a buddy for support who I can go running with. And then to reduce my calorie intake, I've got a few ideas here. I could eat more fruit and veg a day. I could reduce the amount of fast food that I eat. I could buy low-fat produce. And again, I really should be thinking about what are those measures that I'm going to do? What are my process measures now? So I could go to the gym twice a week. I could increase the number of times a week I actually cycle. I could look at getting a buddy and we could do some joint activities. I could increase my fruit and veg to 5 portions a day. You get the idea. So then looking through all those actions and objectives, I look at the one that I can do first, or I might do some subsequent ones, but I'm going to look at cycling to work more. So I'm going to increase the number of times a week that I'm going to cycle to work. So that's going to be my first PDSA. It's that small test that I can try that might lead to that improvement. Now, that was a very easy, I guess, and simple example. And we're not going to go through this driver diagram fully, but I want to just make it clear that you can relate this to your work in, let's say, for a GP for me. We'll start off with our high-level goal, and that is the triple aim. So the triple aim is better experience of care for patients and providers, better health for the population at a cost we can afford. And as we see, that's our high-level goal, and to do that, we need to improve primary health care. These are all on the ministry website, by the way. I haven't made these up. So in order to improve primary health care, There are 4 real strategies: enable patients to find a GP, increase capacity within the system, provide support for vulnerable patients, and strengthen those relationships. And all of those feed up to the triple aim, as you can see. And then feeding into those, what do we need to do to make those 4 happen? Well, we need to improve access to the GP office. And a little bit like the losing weight piece, I can increase my capacity to that GP office, or I can decrease demand, or both. So the question marks at the end are really some of the ideas that some of you have already come up with in your divisions or have already worked through. So let me give you an example there. So one for increasing capacity might be to recruit more GPs and improve retention of GPs. So that might be one way of increasing the capacity, which will in turn improve the access to a GP office. Another one to decrease demand on that GP office may be group visits or health promotion strategies to really try and decrease the demand on the GPs. So that's one example that you can work through, and I recently worked through this with one of the divisions, and they can use it as their whole plan. It's really valuable. It takes a little time to get used to this and work through it, but it's a really good tool to use. Step 5. Now you have some ideas. We're at the point of testing out those change ideas. How do we do this? Well, if we refer back to the model again, we'll see it's the bottom part, it's the doing part of the model. So it's the plan, do, study, act, the PDSA cycles. And the reason that we use PDSAs, again, there's many, but it will help us temporarily trial a change idea and assess its impact. It builds on learning in a structured way, and it is really about the learning. And it can reduce those barriers to change if you can demonstrate it to others, if they can really see. Okay, we have our PDSA cycle, and what is that, let's ask. So, planning. For the plan part of this, we review our aims and measures and decide what we can try that might improve the situation. We think about trying to make it simple and quickly testable, like trying with one nurse and one client today or tomorrow. The planning is really important because it really helps us do it. So now we're going to try our new idea. And then while we're doing it, we're going to study what's happening. So what is happening? Was it faster? Did it work better? Did the client like it? Did it have the outcome that you thought it might do? And you really have to see this in action. And then the act part is you review that test. What could happen next? Do we need to try it on more clients to see if it works with different kinds of people, in different situations, or do we need to modify our idea? And sometimes it doesn't work, and we ditch it and we try another one. And that's why this is a cycle. The ACT step always leads to a new PDSA cycle. So let's go back to an example that we had earlier. I was going to start cycling to work more in order to lose those 10 pounds. So that was our PDSA 1. I was going to cycle to work. So my aim was to lose weight by cycling to work 2 days a week. So what was I going to do that? My plan was to buy a bike, work out a route, and figure out how long it was going to take. Then remember, I have to have my measures. So my outcome measure, did I lose weight? And remember, I'm tracking this over time. And the process measure, did I do what I said I was going to do? Well, did I cycle 2 days a week? And then a balancing measure for me, it's crucial that I'm not late for work. So that's a good balancing measure for me. So I've got my 3 measures, so I'm going to do it. I'm going to cycle twice a week. However, the study piece, I lost a pound, but I only cycled once a week due to heavy traffic. And guess what? I was also late for work. So I abandoned that one. And in my ACT piece, I'm not going to not ride to work because I still think that's valid. But I am going to try and find a faster route away from the traffic, and that might help next time. And that's going to lead to my second PDSA cycle. I'm going to try a different route. So that's one example of how, a very simple one of how a PDSA cycle would work. We have step 6 now, implement the changes. So now we're ready to actually try out some things. So we've gone through our PDSA cycles, and we're looking at how to implement the changes that will lead to an improvement. So first of all, we really have to document and present the findings. I think this is really important to have some documentation here and be able to present them to those interested parties, like we said at the beginning. We have to make the change standard practice. So once we've decided this is the way to go, we have to make it stick. We have to develop a communication plan. There are some really great tools for developing that communication plan and being able to roll it out. And part of that is going to be to train the staff, to make sure everybody's on board. And then we want to spread the idea to another situation. So we want to test again. We might increase the number or the size of the testing. And I think this is also important for spreading those changes between your divisions, because if somebody's already tried, let's say, a recruitment drive and they've had some success with that, it would be really great if we could share those success stories. I know some of them have been shared. But it would be really great if we could have those ideas out there and it's documented and people can take it and see what you've already tried, what worked, maybe what didn't work. And then step 7, the final step. Not really final, we're carrying on, but it's really important to celebrate the success. So think about how you want to keep the attention on what's already been done. And I don't know how you do it in every division, but I'm kind of talking about things like having weekly team meetings, looking back at the results of what you've been doing, looking at those run charts to see how you're progressing and how you're moving closer to those aims. And it's great to get to the point where you have made a lot of improvements, so don't forget how far you've come. It's really good if you can see all those improvements, because it's easy to forget them as you go through, and you can really see how far you've moved. Now, one way of doing this is a one-pager, and we will send the template, although there's also several on the internet as well. But what I'm looking at really is a one-page document that might tell the whole story of your improvement cycles, your PDSAs. Now, the reason that we want to tell the whole story is we want to see, really we want to say, why did we talk about this in the first place? What was the issue? What was really happening in our current situation? And then we might want to say, why was it happening? What were some of the reasons that were contributing to this? And then what did we want to do about them? What was our problem and what did we want to do? And then what happened when we tried our PDSA cycles? And then we can put this all on one page. It's not a lengthy document. I'm not talking about a report here. I'm talking about a one-page summary that tells the whole story of what we did. And with a little bit of practice, these are really valuable. Plus, you can make them into posters, you could put them up in your GP's office, you could show the patients what you're doing, and it just reminds us of what we did. And this kind of document can also, as I said, help replicate and share the work that's already been done somewhere else. So it's going to save you some time. So just to wrap up, we talked about the Quality Improvement Framework, which is the model for improvement from the Institute for Healthcare Improvement. And we also went through 7 steps to quality improvement, and that was defining your aim, developing a measurement plan, mapping out the current state to understand it a little better, and to help identify those possible changes. Then we test out those change ideas and we implement them. And then we celebrate our success and we carry on. Thank you, everybody. So my name is Liz Lamb. I'm the Quality Improvement Advisor, and I'm contracted to work with your divisions over the next few months. And we will be providing support to you. Any questions, please feel free to call or email me.